So let's talk about the structural. There are a lot of different aspects to the structure of the body. Has anyone ever heard of a chiropractor before? Right? So what do chiropractors do? Yes, Ian.
They adjust your bones, make sure they're all aligned correctly.
Okay, adjust the bones, align things. Anyone else? Good. They may do some cranial work. They may work on the muscles, because if you have a tight muscle, you ever see people walk with their shoulders forward? What does that mean? The muscles are tight up here, oftentimes weak in the back. And that may be because of the fact that they actually have a restriction in the mid to low spine. That's oftentimes what I see. They'll have a restriction from mid to low spine. So it's not really here. This is where the tight muscle is, right? And when your posture is like this, when your shoulders are rolled forward, there are blood vessels right here. So if this muscle is tight, it's clamping down on the blood vessel. When the blood vessel goes from here to here, you're changing the size of the opening, which is going to affect how much fluid can go in. If you affect how much fluid can go through the blood vessel, you're going to affect how much oxygen, because the fluid is bringing oxygen, right? With the hemoglobin, with the iron. You're affecting how much oxygen can go to the end organ where that vessel is going. So can you guys see how that can have a huge impact on somebody's life? So adjusting the lumbar spine, or the thoracic spine, low end of the thoracic spine, just opening that region up, can actually strengthen the muscle back here, because you have nerves, right? So if you have compression in the spine, it can affect the nerves. It'll affect the nerves and pull the spine from here to here, and the individual will be much more open, and then it makes it much easier to breathe as well. And when you're breathing better, you oxygenate the brain better, and then your focus is a little bit at a higher level. What can focus help you with? Reading, writing, conversing with people, giving a presentation. If you don't have focus, you're giving a presentation at work. What happens? You're here, you're there, you're jumping around. You can't stay on topic, kind of like me. So you can have those types of issues simply from having, and the thing is, if you go to a practitioner and you tell them I have trouble with my focus, and they're looking right at your skull, and they're palpating everything, that may not be the root cause of disease for that individual, right? It's in the spine. But you have to look at that. This is treating the whole person. You have to look at the whole person. When the person walks in, we're trained that when the person walks in, you look at how they're walking, their gait. Is one foot turned out, both feet turned in? Are they hiking one hip? Is their pelvis balanced? Because if their pelvis is not balanced, it can cause tension in the spine, which will affect your digestion. And the patient will sit down, you shake their hand, you feel, when you shake their hand, you feel it. Is there any sweat? Is it cold? Is it warm? Is it hot? That gives you some more information. You look into their eyes. One of my mentor, Dr. Bovin, when he would see patients, I would see him sometimes he would lean left and right as he's talking to somebody, And I was curious, why is he doing that, And one time I spoke to him about it, and he said, you can see how people's eyes track you, and that'll tell you how the skull is. And sometimes you can see people, I've seen patients where I'm just looking at them, and you can see a very subtle, if you pay attention, you can see a very subtle bulge on the side of their skull. And that means usually when you palpate that region, it's very tender. And that can affect, and we spoke about this the other day, but I'll just reiterate it for anyone who wasn't there at the other talk, that when you have tension here, it can affect a nerve that comes down the back of the spine called the vagus nerve. And that vagus nerve, has anyone ever heard of the vagus nerve? It's been in the news a lot of health articles about it. Yeah, good. So the vagus nerve goes down and affects the heart and the stomach and the intestines. And if your vagus nerve is not functioning well, you have a lot of anxiety. You're not calm, you're not relaxed. You don't feel comfortable in your skin, right? But if you relieve tension from the vagus nerve, your stomach starts functioning better. So a patient comes in, has a lot of bloating, heaviness in their stomach. They feel like when they eat 2-3 bites of food, they have to unbuckle their belt. What does that mean? Does that mean that the problem is in the stomach? Not necessarily. That's the end. That's the check engine light right there. Everyone understands that? That's the check engine light. There's 2 ways to fix a check engine light. Anyone know how? 2 different ways to fix it, general ways. One, you take a pair, and I'm going to teach you guys this is really important. You take a pair of scissors, you go right behind the dashboard, you can cut the light. Cut the wire going to the light. That's one way to fix it. And that light will never turn on for the rest of the life of that car, ever. It's one fix, and that's a permanent fix, right? The other way to fix it is actually to get underneath the car and you take a look at the whole entire car, from the beginning to end. nose to tail. And you find the problem and you fix that, the light will turn off, right? So that's the sign, right? And then the symptom that the patient is having is the pain, right? So you have to kind of look at the body holistically as a whole. It may be that the person has bloating in their stomach because whenever they were 2 years old, they were, for example, physically abused. And that trauma kind of set in their brain, shut off different regions of their brain. And I see this in patients. I can track their eye movements and find out how traumatized they are, right? And from that, you can kind of correct it. There's certain ways to correct we're not going to go into, but there's certain ways you can correct that and then bring more blood to their brain and calm them down, bring them into a more relaxed state, and allow their digestion to work well. So the Prophet ﷺ would sit down when eating, right, Maulana Sahib? Maulana here, mashallah, we have Maulana Hakim here, so I should make sure I watch what I'm saying when I speak of the Prophet ﷺ. In general, I should as well. But he used to sit down when he ate. And this is what I advise my patients to do as well. Be in a calm, relaxed state. Because when you're walking around and you're moving and you're eating your sandwich on the go, then the blood is not going to your stomach. It's going to your limbs because you have to walk, right? You need blood in your legs to move your muscles. You need blood in your arms to swing your arms while you're walking. So the blood's not going to be in the stomach where you need it to actually be creating more acid and releasing the enzymes from the pancreas and be absorbing it in the small intestine. It's not there. The blood is in other areas, right? So going back to the structure is really important. We spoke a little bit about cranial structure and how the skull being shifted out of place because of a car accident. Some people come out of car accidents, they're like, oh, I'm perfectly fine, I hit my head. I don't need to go to the hospital, I feel okay. And ever since, when I do a history, when someone comes up with symptoms, I ask them, did anything happen during that time? And oftentimes something happened. It's like, I don't think it's related to my shoulder pain, but I did twist my ankle that same day, 4 years ago. I twisted my ankle, but I don't think it's related to my shoulder pain. Go down to the ankle, palpate the ankle, put a little pressure in different areas, very tender. I test some of the muscles, very weak. Compared to the other side's perfect. And correct the ankle, go back up to the shoulder. Can you move your shoulder around, sir? Move the shoulder, wow, feels better. Didn't touch the shoulder, right? And sometimes patients will tell me, it's really interesting, they'll be like, I'll do an exam, and it'll be, let's say, you do the shoulder example again, it'll be a shoulder complaint. And I'm looking at their pelvis, and I'm looking at their knee, and they're like, Doc, I think it's here. Trying to remind me that their main issue that they came in with is shoulder pain, right? And of course, I understand what's going on, and I have to explain to them, the whole body's connected, and it's basically what we're doing right here, right? So that's the cranium. Does anyone have problems with their jaw? Clicking, pain in their jaw? That's a joint, if you think about it. So this is part of the cranium, this is part of the structure, right? That's a jaw. I work with a professional boxer, mashallah, and I was treating him one day, and what you notice about people in boxing is that they oftentimes get clocked in the jaw, right? And some of the best hits, if you ever watch boxing, will be when they come around and they hit somebody in the jaw. That's when you know. As soon as you see that, you don't have to wait for the person to go down. You know they're going down, or they're getting woozy. Why is that? It's because a lot of the nervous system comes in right through this joint right here and right here. So I see when a boxer comes in, oftentimes they have a lot of tension in their jaw, right? A lot of trigger points. Sometimes you have to go inside. This is the most painful area. People have tears coming out of their eyes as I'm treating this, because of how tender it is. But if you think about it, the jaw has to be aligned perfectly because it's a swinging joint. It kind of shifts left and right, right? And if it's not aligned, then your body feels like you're tipping sideways ever so slightly. Some people, they live like that. They think it's normal, right? Because you can't compare yourself to another person's body. So a lot of times people don't even know what normal is, right? So they think that, that their body's pulling over to the side is normal. Or that their body's shifted this way, it's perfectly fine, right? Oftentimes it's because the jaw can be potentially shifted over. So that's the importance kind of the cranium and the jaw. The spine is like, I don't even want to go into that because it just makes logical sense. All the nerves come out from the different areas of the spine. Oftentimes people with stomach problems don't have tension between T5 and T9, the thoracic spine right in the middle of the back, right behind here. And that's because those are the nerves that actually go out to the stomach. Let's talk a little bit about breathing and the diaphragm. This is also associated with structure. And I want to do a little exercise with everyone here. I know these topics sometimes can be kind of dry, okay? So we're going to move into a little bit of exercises. So with breathing, breathing brings oxygen to the whole entire body. Everyone understands that, right? You can't breathe for a few seconds. You can live with water for a long period of time, without food for a long period of time, right? Without coffee for a very long period of time. Actually, it might even extend your life if you stop drinking coffee. But with breathing, you know, if you stop breathing for 30 seconds or so, you can have serious damage to your brain, right? It requires a lot of oxygen. So I like to teach my patients how to breathe properly. Now I want everyone in here to take a deep breath. Deep breath in. And if you look around the room and all the way out, take another deep breath in. If you look around the room, many of us are breathing like this. Okay? In Chinese medicine, that's called floating. See what happened? The chest, the shoulders, everything rose and then came back down. That's called floating. Right? You're very unstable. If I push someone like that, they might shift over a little bit. The proper way to breathe is the way that babies breathe. How do babies breathe? Anyone have a baby? Some babies in the room, maybe? How do babies breathe? Okay, Yassine, what did you say?
Through their stomach.
Through their stomach. Does everyone agree with that?
Yes.
Yeah? You guys will watch babies breathe through their stomach, right? So when they're breathing through their stomachs, it brings a lot of relaxation to the whole entire body. And you have two containers, right here, and what you have in between is something called the diaphragm. Everyone know what the diaphragm is? A big muscle between the stomach and the lungs, and it pushes down whenever you breathe in, unless you're breathing like this and you're lifting the chest up, right? So when that pushes down, all the blood vessels in the abdomen get stretched and compressed, right? That stretching and compressing pumps the fluid in that area and clears the fluid. So with every breath, you're actually clearing, if you're breathing properly, with every breath, you're actually clearing a lot of the fluid in the vessels and increasing the circulation in the abdomen. And when you increase circulation somewhere, it cleans the area out. What happens when you have like a pond and the pond is stagnant? You ever go to like in Illinois or in Chicago where I'm from, they have a lot of like ponds because everything is level. They'll have these ponds and then they'll have little water fountains in between. And at first I thought maybe these water fountains are here because, you know, for aesthetics, you know, they look pleasing, a little water coming out. And then later I realized that if the pond is stagnant, what happens? What grows in there? Algae will grow in there, different fungi will grow in there, and then you'll get these little insects that are really fun to have on you. Mosquitoes, right? You'll get a ton of mosquitoes in the area. So they have these water fountains actually to keep the water moving, right? Because when things are moving, you have life, right? And we have stagnation, things start breaking down, and you get all these different unwanted, let's say in the body, would be bacteria, viruses, different things like that in the region. So with breathing, when you increase the tension in the stomach, all that fluid will start clearing out, and with every single breath. And how many times do we breathe a day? So many times, right? Every second is another breath. So what I want everyone to do now is I'm going to teach you guys how to breathe properly. And there's different types of breathing, and in Chinese medicine they have a whole science to it, and it takes a long time to advance in multiple levels. But if we just get the first basic level down, for most of us, we're not high-level athletes or anything like that, or martial artists, this should be just enough for us, right? I want everyone to take one hand, put the palm over their umbilical region, they're a little bit lower, so we're going to be right around here, right? And I want you to take a deep, actually don't even take a breath in. I want you to push your abdomen out forward, push your hand out as far as you can go. What do you guys notice about your breathing whenever you push your hand out? You have to inhale. You have to. You cannot push your abdomen out and exhale at the same time. You have to inhale. Do you guys notice that? Okay. So I want everyone to do this 10 to 15 times every morning. Make it a habit. And eventually it will become something that is natural, right? So if you do this 10 to 15 times every single morning, pushing the abdomen out. It will become something that's natural, and you won't have to think about it. I spoke to my mentor, Dr. Bobin. He actually said that there are people who do this naturally. You know, we're all like city dwellers here, sitting in the city of Pittsburgh, right? So we're all used to being stressed out and things like that. But the Amish people, oftentimes, Dr. Bobin said, in his clinical experience, those individuals will actually breathe properly through their abdomen. And if you ever watch the Olympics, the runners, the ones from Kenya and in Ethiopia and different African countries, they'll oftentimes have a little bit of a gut. They don't suck it in, they have a little bit of a gut sticking out. And that's because they're breathing right into their abdomen. It's relaxed. And this is an area, the abdomen is an area where energy can come from the lower body and be translated to the upper body. So in martial arts, which I'm not a martial artist by any chance, we may have some in the crowd, but what I learned from Dr. Bobin is that in martial arts, they'll actually begin with breathing and teaching people how to breathe properly, because you can generate a lot of force in the upper extremity whenever you breathe properly. Right? Okay. So let's move into, does anyone have any questions about the structural breathing in general? Does that make sense to everyone? It's a very simple concept. And watch how and next time you see a baby, watch how they breathe. And you'll see it's natural for them to breathe in that way. Yes?